Common prednisone side effects and what you can do about them. I'm Dr. Megan, your prednisone pharmacist, and I'm here to help you find answers in your most pressing questions about prednisone. So today, what are the most common prednisone side effects? First of all, I want to explain where I got this information so you can understand that this is a credible source. So what I did is I did a huge search of the literature. I looked at the top 5 most credible and reliable drug information sources for pharmacists today. From UpToDate to Micromedics and Lexicomp, all of these top tier clinical pharmacology drug references. And then I took everything that they said about prednisone and I distilled it down. And when they said it was a common side effect, that's when I included it in this list today. So every single person experiences prednisone side effects differently, but there are some that are a lot more common. We're going to go through them in an order of how often they were referred to. So if all 5 of those drug references referred to the side effect, that's what I'm going to talk about first as the most common side effects. Then we'll drop down to 3, and then we'll drop down to 2. So starting with the 5, every single drug reference had all of these next ones included. And this first one is the one I think people don't know about and need to know the most because there's something you can do about it. And this first one is osteoporosis. Osteoporosis is when your bones get thin and they crush and they break and you feel like you're old before your time. Osteoporosis is the number one thing that they all talked about, and you can take calcium and vitamin D every day to do something about that side effect. So that was the first one. The second one is fluid retention, like swelling, water retention, just all of the miserable things that prednisone can do to make you feel and look fat. And so you might get a swollen face, you might get swollen hips, joints, belly for sure, and it makes you want to pee. So that's the second one. The third one is related to that. You have all this extra fluid that your heart has to pump. That increases your blood pressure. So high blood pressure, another word for that is hypertension. And for all of these side effects, I'm trying to give you both the scientific term and a simpler to understand term. Okay, the next one is emotional lability. What is that? That basically means you're on an emotional roller coaster. Prednisone makes your highs higher and your lows lower, and the higher the dose, the worse it interferes with your emotions. So that's the next one. Now we're going to your eyes. We're talking about cataracts. A lot of people don't know about this one either. Posterior subcapsular cataracts. Ooh, big word, right? It's way back there on the back of your eye. On your lens, you can get cataracts and they are detectable. And then you can get cataract surgery if you need to, but they're permanent. And if you're not getting your eyes checked at least once a year while you're on prednisone, yikes. Okay. The last one that was listed in all 5 drug reference sources is skin atrophy. And I don't really understand why this is listed in all of them. I hardly talk to anyone who talks about thin skin or parchment-like skin. I know it happens to some people, but this is not a common one in my mind. Nobody complains about this. I never hear anybody oh wow, everybody I know on prednisone has thin skin. No, I don't hear that. It happens, but I don't think it's the most common. So I don't know why they called it the most common. All right, now we're down to 3. The top 3 sources included these ones. And I think this one should have been on all of them. The other 2 were missing it, and I don't know why. And this one is appetite stimulation. Appetite stimulation means you're hungry all the time. Prednisone interferes with your satiety, your oh, I'm full hormone. and it just makes you want to crave salt and sugar. Ugh. That leads to weight gain. That is the one thing that they should have listed on all of them, and why wasn't that included on all of them? 70% of people on prednisone gain weight, and yet 2 of the sources didn't even include it. What in the world? All right. And so that was, appetite stimulation and then weight gain, and then the next one is also related, called decreased carbohydrate tolerance. What is that? That means sugar. Carbohydrate equals sugar. Your body has a harder time coping with sugar. You can't, like, if before you could just eat a whole chocolate cake, now that's going to give you really high blood sugars, and high blood sugars leads to diabetes. So while you're on prednisone, you need to be extra careful that you minimize sugars. Cut out all the excess added sugars from your diet while you're on prednisone. You just can't do it unless you want diabetes and weight gain and looking like you're pregnant when you're not. Okay, next we're down to 2 sources. Hypercholesterolemia. This means high cholesterol. And that's related to the other heart problems we already talked about, like high blood pressure. So the consequence of high blood pressure and high cholesterol is heart problems. And there's things you can do about this. All right. The next one is also related to one we've talked about before. Osteopenia. So osteoporosis we already talked about, and that's when your bones are thin. Like definitely a lot thinner than somebody your age. Osteopenia is where it's getting close. You're almost to osteoporosis. It's thinning. And for both of these, you need to be taking calcium and vitamin D every day you're on prednisone and after to fill back up your bone stores. All right, we're almost near the end. Down to only 1 drug reference source included these, but they did call them common side effects. So that's why I'm including them today. This one is called leukocytosis. That means high white blood cells. This is why it looks like you have an infection while you're on prednisone, but you don't if all they looked at was your white blood cell count. It's this weird thing that prednisone does. Then this one is related to another one, irritability. So back to the emotional lability. So people on prednisone are just cranky. And it's hard. But I want you to remember, it's not you, it's the drug. It's that prednisone, it's not you. And explain that to your family too. They need to know. All right, and I have a video about that if you want to check it out. The last one, I think most people know this because it's what the drug is. Prednisone is an immunosuppressant. That's why a ton of people are using it for their autoimmune condition or to turn off the inflammation in a condition. And so most people know that it's an immunosuppressant. So immunosuppression. That's why we need to be extra careful in this environment with COVID-19, the virus. You are more susceptible for poor complications. And you don't want to do that. So take all the precautions you need to take because you are taking an immunosuppressant medication. All right, I promised you that I would tell you the top most common side effects of prednisone, and I've covered 14. Now, I also promised I would tell you what you can do about it. So what you can do about it, I've told you a few pearls throughout the presentation today, but if you want a summary, a little checklist, a cheat sheet for what all of those are, I'm going to have a link below, but you go to get your prednisone checklist, and it has all of these tips I've shared with you, plus the top mistakes people on prednisone make, and all of those 25 tips of what you can do about prednisone side effects. I'm Dr. Megan, your prednisone side effects pharmacist, signing off.